questions from Dr. Dammika. Now I would like to introduce today's resource person, Dr. Dammika Perera. He has obtained his bachelor's degree from Faculty of Veterinary Medicine and Animal Science, University of Peradeniya in 2004. Later, he has obtained his MPhil degree in Advanced Reproductive Biotechnologies from the same university. Further, he is a fellow of Sri Lanka College of Veterinary Surgeons and member of International Embryo Technology Society as well. During his postgraduate studies, Dr. Perera was able to establish the embryo transfer technology, embryo splitting technology, and embryo freezing technology in Sri Lanka. I'm pretty sure that all of you are aware about his research. It was very popular in Sri Lanka, and everybody knows him as the person who has invented this technology in the country. Besides, he's the person who has done the first successful artificial insemination of horses while being the resource person of the first successful sheep AI project and sex cattle semen AI project in the country. So he's an expert in the field. And in addition to that, not only conducting activities related to reproductive biotechnology, he has published more than 80 research papers and clinical papers locally and internationally. During the last 17 years of his work as a veterinarian, he has been awarded more than 10 professional awards for his clinical research and professional contribution, including Perumal Pillai Award, Dr. Hector C. Pereira Memorial Award, Air Commander Dr. RMPA Dasanayaka Award, and Dr. and Mrs. Mohammed Award from Sri Lanka Veterinary Association. Presently, Dr. Perera is working as a senior clinician at the Farm Animal Veterinary Teaching Hospital and a senior lecturer at the Department of Farm Animal Production and Health at the Faculty of Veterinary Medicine and Animal Science, University of Peradeniya. I warmly welcome Dr. Dammika to share his experience with our budding scientists who are eager to publish their research work and the case studies that they are conducting at the field level. Over to you, Dammika. Dr. Dammika.
Thank you very much, Dr. Krishanti, and thank you very much, Dr. Mallawarich and Dr. Sugat. I think can you see?
Yes, we can see
my screen.
Yes, we can see.
Right. I think now you can see my screen clear, yeah?
Yes, we can see the slideshow.
Right. And good evening, everybody. As Dr. Sugat mentioned, this is third webinar regarding this scientific writing. So in this discussion, I am going to discuss about how to publish a case report in a reputed journal. So I am pretty sure most of our vets are handling number of cases per day. So they are working hard. They have I am sure most of you have came across many new cases. Sometimes you may have handled very rare cases. Sometimes case may be usual, but you may have different experiences. You may have tried with the human surgical techniques, so you may have different experiences. But the thing is that knowledge, that experience may be with you. You may not have shared that knowledge with our other professionals. Sometimes you may have discussed those things with your friends. So sometimes you may not have enough evidences with you, right? So the main purpose of this session is to show you the way to express your knowledge, to disseminate that experiences with our professionals to the world, right? Then my main target group is beginners, for the beginners and our field vets, those who are working hard, those who have many experience with cases, but that knowledge may be with you. So in this discussion, I am trying to show you the way that you can disseminate that knowledge to others. So well, at the beginning, we'll consider about the case study. So what is a case study? Case study mean the study about the real cases or the real clinical cases that you have came across while you are working, right, in your vet office, maybe in your different places. So the real cases that you have handled, right? So that may be either ad hoc cases, or sometimes that may be pre-planned cases, right? So you can consider those things, you can publish those things as case study or the case reports. Ad hoc cases mean while you are working there, you may get a complaint from a farmer or your clients, right, regarding certain matters of their animal. Then you will handle that case. That case may be new, the animal may recover. So then if it is a valuable case, then you can consider it as a, you can publish it as a case study. Or pre-planned case mean then if you are willing to publish something, right, with regarding your experiences regarding that new cases, then or regarding existing cases and new approaches of existing cases, you can plan to collect data, and you can analyze those data, then you can publish it later on, right? Those are pre-planned case studies. So those case studies may be either prospective or retrospective. It means, as I mentioned earlier, that your cases, you can, while you are working, you can handle that case, you can collect data while doing that case, right? For an example, a farmer may complain about that reduced milk production in a cow. Then you will visit there, then you will handle that case, then you will examine, you will diagnose it, you will provide treatment for that. So then finally, if it's an important case, you can publish it, right? Then retrospective mean then you may have number of or lot of evidences you may have in your history sheets in your vet office. So the cases that you have done previously, you can collect those data, then you can analyze those data, then you can publish those as case studies, right? Those are retrospective studies. You can do those case studies in both way. Then what kind of cases you can report? Although you are handling number of cases, right, thousands of cases, we can't publish almost all the cases, because we have to have a place, we have to have a medium to publish. So we have to, for that, we have to select a available journal for that. In journals, they have different conditions, different criterias, different selection methods. So we have to adhere to their guidelines or the criterias. So according to that, right, we have to adhere to their guidance. With that, we have to we can publish a new case, right? Nobody has seen that, so it is not a reported case previously. That may be a new case. Then you can rare case, right? It has reported, but very rare, right, in the world. So most of the vets may not have aware about that, may not have that experience. Then again, you can publish that. So sometimes cases may be routine, usual cases, but you may have approached it in different way. You may have tried with different treatment protocols successfully. That may be either medical or surgical. That your treatment approach may be that new, although that cases are usual. So again, then you can publish that data, considering that novelty of the treatment approach. So other thing is routine cases with new developments, new that or changes of the etiology, right? Causative factor may be vary. Clinical picture may be usual, but in your analysis, in your investigation, you may able to find that new causative factor for that. So then again, you can publish those data. So in addition to that, different clinical manifestations or the complications of clinically important conditions. So that condition may be usual, but clinical manifestation, clinical signs, clinical appearance, clinical complications may be new or significantly different from the previously reported data. So again, you can disseminate that knowledge to the others. These possibilities also they are like that. So in addition to that, the deep analytical reports of regular cases, that cases may be regular, but we can collect data on 100, then we can publish those data in a scientific journal, because that although cases are usual, you have used hundreds of data regarding the same usual type of cases. So then that analytical value would be very high. So you can publish those data again in a reputed journal. You have that chance. So most important thing is, especially if you are handling if you are doing a prospective type of study, that although you have tried with new method, ultimately if that animal has died, then it will be useless, right? So to explain to others. So if your approach is successful, then you can try to publish it to disseminate that knowledge to others. What are the types of case report or the studies? There are several types of case reports or studies. So I have seen three types of main case reports or studies. So one is case report with single case, or in that case report we'll may discuss about a single case. So other one is case report with several cases. They are talking about several cases. So other one is case report with large number of cases. Those are the three main type of case reports that you can see in a journal, right? But in addition to that, you may see different papers with the animal involvement. It means with animal trials. So sometimes you will misunderstand it as a case report, because due to the animal involvement, but those may be a research paper, original research paper, including animal trials, right? Let's see in detail about those things. So what's a single case report? As I explained earlier, it explained only about a single case, right? That's the primary thing, single real case. If you want to publish that kind of a single case, that novelty should be very high. That should be a new case, or it's a very rare case, that our readers should have many things to learn from that article, right? So that editorial board or the journal may consider those aspects when you try to publish it in a journal. So most of the time it would be a prospective. It means while doing the case, right, may collect the data and may publish it, right? Then other thing is condition or the disease may be a common one, but new etiological, new diagnostic approach, or new successful treatment plan may be there. So with that, you can publish it, right? So let's see one example for that. In this paper, yes, in this paper, right, they are talking only about a single case, carpectomy and partial arthrodesis as a surgical intervention for unilateral congenital flexion of carpal joint in a crossbred heifer calf. Right. So right, they have tried to correct this congenital flexion of the carpal bone in this heifer. Right. It is not a new thing. It is rare, but it is not a new thing. Right. But the main novelty is the treatment approach. Right. So when you get a case, do you have a treatment plan for that? Think about it. So experimentally, they have tried to remove the carpal bones, right? Then they have cut the either side of the bone. It means right distal epiphysis of the radius and ulna bone. Then other thing is the proximal epiphysis of the metacarpal bone. Right? Partially they have removed that. Then they have corrected. Right? So successfully. Finally, here you can see the right walking of animal with that treatment. So the treatment plan is novel. It is not reported in a book. So reputed journal. Right. Likewise. So then let's see the other one. Other method is other type of cases. Case study is case report with several cases, right? To explain that, I'll get that this example. So in this paper, right, they are talking about equines, right? Here, as you can see here, they are talking about 3 cases, right? They have handled 3 animals with ocular pneumonidiasis, right? Again, it is not a new thing. Those are rare, but those are not new thing. And treatment plans also there. Treatment protocols also there, but those are very invasive type and with high risk, we have to do that. So existing treatment plan is to inject ivermectin across the cornea to the eye. So in this paper, they have explained about minimally invasive technique, right, without damaging to the cornea. So using in first case, they have used a 18 gauge needle, and they have passed that needle through the limbus without damaging to the cornea, and they have done we have aspirated the worm. So, but while passing that needle, it can damage to the cornea. That risk is there. So they have further developed it to use the you can remove the stylet, then it may not damage the cornea. So likewise, they have developed it further, right? So that way, with that novelty, with that scientific merits, we can publish those things in a scientific journals, right? So we have to have that scientific approach there. The third method is case report with the number of or the large number of cases. Again, that should be a report with existing real cases. That is the identical thing here. Then maybe common conditions. For an example, we can study about canine babesiosis, right? That is not a new thing.
Dr. Dammika, sorry to disturb you. We can't see the slide. Only the previous slide you can see.
I see. What about now?
Still it's there, but I think if you can stop sharing and then again share, then it will go.
I think you have shared the PDF file, not the presentation.
All right.
I have shall I stop sharing?
Yes, please.
What about now?
Yeah, okay now.
Now you can see it, no?
Yes,
right.
Yeah.
Okay, right. Thank you. Now here I am talking about the other possible case report. So in that case report, we can see now about regarding number of cases, maybe 100, maybe 1,000, maybe higher number. So main thing is, anyhow, we have in this paper, we have to consider about the existing real cases, not an artificially made cases, right? So that report may discuss about the real cases, right? The cases may be common regarding common condition, right? So when you consider about an individual case, that novelty may be lower, but when you consider as a whole, that it is having very high scientific value because they have used they have handled number of cases. For an example, we can talk about report about canine babesiosis. That is a common condition, but we can study about that canine babesiosis in prospective manner while doing the cases, or retrospective using the available records. So especially if you are doing it prospective manner, we have to plan it, we have to record all the data, right? So we can do the special analytical part, we can do special diagnostic test, to collect more data, right? So then finally we can publish that higher number of data. So we can analyze it, right, using the statistical techniques, right, methods. So then the accuracy of the outcome would be very high. So higher analytical and scientific value would be there. So with that, you will get a higher value to your paper, right? So for that, we have to prepare a data collection sheet, right? So without using a data collection sheet, we can't plan this kind of cases, right? So case reports. For that, you have to have a pre-plan, right? Then you have to collect data, right, according to your plan. Then you can analyze it, right? Once you try to analyze it or collect data without using a data collection sheet, you may collect data in different cases. Finally, you may not be able to analyze those things due to lack of the required data with you. Right here, one of the example for that, as you can see here, this is a data collection sheet to collect data regarding the urolithiasis in bucks, in male goats, right? As you can see here, right? I'll go through that, right? If you are the main person, you have to mention presence of a case, please inform to that main person. Then, right, others may inform you, right, for further studies. Then your telephone number, dates, then owner's detail, signalments of the animal, then main complaint, previous report, of similar condition in the same herd, then management system, whether it is intensive, semi-intensive, or extensive management, feeding, about the feed, grass, fodder, and other feeds, concentrate, then mineral vitamins, other types of feed, sometimes brands, all mineral, right? You have to record all the about the all type of meal in your record sheet. Then water supply, whether they are giving ad libitum water, intermittent supply, or no special supply, likewise. So that clinical findings, dysuria and urea, like that, dribbling of urea, right? Distended abdomen, stretching of scrotum, right? Trapped uroliths at the hair of the preputial orifice, obstructed urethral process, likewise. So other findings, you have to record everything. Then the scanning findings, because you are going to publish this data for your reference, you have to do the additional tests. So we can go for the scanning to scan the urinary bladder. Then you can report calculi in the bladder, calculi in the sigmoid flexure, calculi in the other places. Likewise, you can report those things, right? Then number of uroliths that you could collect there. Then a decision or the treatment plan used there. Removal of urethral process, upper ureterostomy, surgical corrections of bladder rupture. Then sometimes you may decided to cull immediately, right, due to the management decision. You have to report everything. Then if you have treated for that animal, response to the treatment, then we can go for the hematological analysis. calcium level, phosphorus level, and magnesium level, like that. Then finally, you can analyze the collected uroliths and you can report it. Then analytical report of feed sample, you can get a feed sample from that particular place. Then you can analyze it and you can report it. You can collect those data. Then finally, you can use those data to publish, to write your report, right? So likewise, so you have to have those data with you, right? Then you can go for the statistical analysis, right? So we'll try to see a example regarding this kind of paper. Right here, if you can see this paper, I think all of you can see this. In this paper, they are talking about classification of glomerulonephritis in dog, right, or the kidney disease, right? Simply, kidney disease is a common condition. It is not a very rare condition, right? But they have analyzed in this paper.
Excuse me.
They have analyzed 80.
Excuse me. Dammika, we cannot see the paper. Now we are seeing the presentation.
I see. Again, I have to stop sharing and come to the
Yeah.
I see. When I use that,
because you are using two different
no, it's okay. But yeah.
No, I think it's really helpful for the participants to see the papers as well.
Yeah. So what's wrong with that? So when I go with that attachments, you are getting a trouble.
That's right.
Yeah. So still you can see only the slides.
Still the slides.
Still the slide. All right. Now we can see the paper, isn't it?
No, not yet.
Not yet.
No.
I see. So
always these hyperlinks give problems.
Yeah, that's the problem. So what shall we do? So what about now?
No, we cannot see anything now. Just we can see you. It indicates that you have started. Again, we can see the presentation.
You can see the presentation now.
Yeah, presentation.
What about now?
No, not yet. Better you open. Okay, we can see it now. Light green color document, right?
Yeah.
Yes, we can see. Thank you. So sorry for the trouble.
No, it's okay. It's okay. So I think you can see that title of the paper, isn't it?
Yes, we can see it.
Yeah, it's talking about the classification of glomerular disease in dog, right? Simply type of kidney disease, right? Those are common conditions in dogs, but they have, and in this case report, they have handled 89 cases, right? They have collected biopsy samples, then they have checked 114 lesions, right? Analyze that. They have very big set of data with them. Then they have analyzed it and they have published that data. So it is having very scientific value. Lot of information available in this paper. So, but although that case is that type of the case is usual, we can write when you pre-plan, you can analyze it right nicely. You can collect valuable data. Then you can write publish those data, right? Dr. Kishanti, can you see the next slide now?
No, still the PDF file.
I see. When I use PDF file, always I have to stop sharing.
Yes,
Again,
that's
I have
what
to.
I think.
Right. I think you can see the next slide.
Yeah, okay.
Right.
Research papers.
Okay. Yeah, research papers with animal trials. Right. So these are not that case studies. These are research papers, but they may use animals for their research studies. For an example, for oncological studies or CKDU, that chronic unknown etiological chronic kidney disease studies. So wound treatment therapy, right? So when we look at the oncology treatment or the cancer therapy, so they are people want to develop treatments for that. Still space is there for the to understand the etiology of that. Although there are a number of treatment plans, still it is open to develop more efficient, more economical treatment for wounds. So then researchers can plan research. They can develop objectives. They can identify hypotheses. So they can design clinical trials. In that clinical trials, they will use animals. Then they will divide those animal group at least into two groups. One is control group, other one is treatment group. Then if they want to do the oncology or the cancer therapy treatment, at the beginning, they have to make cancer to that animals. For that, they will use different chemicals. They will inject it. Then they will induce cancer in that particular treatment group. Then they will try with their treatments like that. So those are not real case studies. Those are real pre-planned research, although that animal involvements are there, right? So that's what you have to understand here, right? So then how should you plan a case study, right, to publish in a reputed journal? So once you get a reportable cases or cases, you have to decide the required facilities and collaborators, right? Because always you may not have that required facilities with you, right, in your place, in your vet office or in your working place. So then you have to identify the required facilities, right, and available places. So then you can discuss with the chief personnel of that place. Then you can come to agreement to collaborate for this study. Then as a return, you can give that authorship in your publications to them, right? You have to keep records in writing about all the steps, history, report of diagnostic test, procedures, everything, right? Then you have to make arrangements to get all the necessary images, right? Especially when you are going to publish a case report, you have to have that image-based evidences with you, right? You may have done very important cases, but you may not have that evidences, especially images of it. Get the client contact detail for the follow-up, right? Definitely you have to have a follow-up content also in your report, right? Then you have to follow up after several months, several days, several weeks. Then you have to have that idea. Then before, although you have all the necessary data, you should not start writing a case report, right? Instead of that, you have to start from the selection of suitable journal, because that you can write a report, but your report may not be compatible. Best thing is you have to select a suitable journal, right? So how to select a suitable journal to publish a case report, right? For that, you can go to the internet, then you can go to a search engine, type in just like Google search. Then you can just type veterinary journals. Then you will get different types of veterinary journals, right? This is the simplest way. Then that may include fake journal, true journal, right? Index or not, right? Different type of journals, maybe they are in that list, right? Then sometimes you will get fake advertisement, right? So fake advertisement means you will get when you search like that, you will get advertisement saying that if you want to publish, this is the easiest method. We will publish your any type of report within 1 week, within 2 weeks, like that. You have to pay only minimum amount, like that. So we can't publish this kind of case report within 1 week or 2 weeks, right? Those are fake advertisements, right? Their main objective is collecting money from you, right? So that kind of fake message may get, yeah, right? You have to be careful, right? To avoid that, we can go for much more information, right? We can search for index journals, right? Scopus, Google Scholar, SGR, SCI journal. So there are different type of index journals. Indexing mean, when I explain it simply, there are bodies that non-profit oriented bodies, they are ranking available journals according to the impact and the scientific value of those journal. They will rank it, right? There are different type of ranking system. Those are the Scopus, Google Scholar, SGR, CI, right? Those are different type of ranking system when I explain it simply, right? So then we have to check the when we have to open the journal site, right? You will get a list of journals. Then to see more detail, we have to select one of that. Then you have to go for the journal site. Then when you go to the journal site, you will see a icon about the journal, right? Then you have to click it. Then you have to click it. Then you will see about the message about the journal, right? So frequency of publishing, right? Then that organizing body about that, or different information about the journal, right? So I'll try to show you one example. So in that, when you go to that site, you will see right here, this is one of the journal site. So here you can see about you. When you click here, then you will see this message, right, about the journal. They may explain about the journal briefly, right? Then you can have an idea about that journal, about that publication body, that frequency, right? You can have an idea about that, right? So then you can see under that, you can see whether it is an open access journal or not. Open access journal mean, when I explain it simply, it is open for readers. Readers can see the abstract and readers can download the entire article, right? So sometimes that journal may not be an open access journal. It may be closed. It means everybody can see the abstract of it, but if you want to read it, you have to pay to the journal. Then you can see the complete article there, right? After that, you have to go for the aims and scope. There's another icon, right? That menu, you can see aims and scope. You have to click that. When you click it, you can see the aims and scope of that journal, right? So with that, you can have an idea about the scope of that journal. I think, can you see this JAFR journal site? Now I have opened up. Can you see
Sorry.
it? No, no.
No, we cannot see.
Right. Okay. Then that problem is there. So
Yes.
So what about now?
Okay. Yeah, we can see it. Thank you.
Now you can see the JAFR journal, huh?
Yes.
Side of that, right? Okay. Here you can see the at the left upper corner, you can see about the journal, then aims and scope. When you click it, you can see the aims and scope of it. Under that, they have explained about the their scope. They are whether they are accepting research papers, whether they are accepting review papers, whether they are accepting case reports or not. Likewise, you can get many information and the areas that you can send your manuscript, right? So you can have an idea about that, right? Then you can, I think you can see the slide now.
Yes, we can see it. Thank you.
Right. Okay. Right. Then you have to see the guide to authors. That's another menu. You can click on that. Then you will see the guide about the guide to the authors, right? Then under that, you can most of the time you can get the information regarding whether that they are charging for the manuscript processing, right? Because sometimes journals may charge from your side, from the authors, right? That consider that different levels of charges may be there. It's depend on the journal. They will charge some amount from you as a manuscript processing charge, right? But not in almost all the journals, right? Only in some journals. If you are not willing to pay that, you have to select a journal, right, that they are not charging for the manuscript processing, right? There are journals, right? They are not charging any amount from any party. It means either authors or the readers. So you can select one of that. For that, you have to follow those things, right? You have to read about the journal, then you have to read their scope, then you have to go for the guide to authors, right? When you go for these three menus, then you can find those necessary information, right? So then you can see the under that guide to authors, you can see the sample article, right? Sample article, they may have given a template for that, right? This is the way that you have start your writing, or the way that you have to write it there, right? I'll try to show you one template. Right, I think you can see this template. This is the template sample article. So that if you want to publish that your case report in this journal, you have to adhere to this template, right? You have to write using Word 97 to 2003 type documents. Then you have to write your font size should be 11. Then table, figures, references should be in 10 font size should be 10. Then you have to have this hide extra bars and tables. Extra bars mean you can use only in your table, you can use only horizontal lines. You can't use vertical lines, right? That's the meaning of that. Then they have given a templates. See, this is the way that you have to write that title. It means capital block letters. If you are adding some scientific names, that should be italic, like that. Then author's names, right? Likewise, you have to write that article according to this template, right? So see here, you can see that. So you have to write it as a single column, right? Then I'll show you, I'll try to show you Another one. This is the right. I think with this you may see a manuscript written
Dr.
according to that
Excuse
template.
me.
Can't you see that?
No, we cannot see.
I see. Okay. What about now?
Yes, we can see it.
Right. So, right, this is one of the manuscript written according to that template, right? So adhering to that template. So according to that template, we have to write that article as a single column. We have to write it there. Then you have to add all the figures according to that guideline at the end of the article, like this, right? Then finally you have to add the references. So that is the way that we have to submit it according to their guide. How to maintain 1.5 or 2 gap in between two lines, right? That's how you should submit it, right? Then then you can see the published article according to that. I think you can see this. Dr. Krishanti,
Yes,
can you see this?
Yes.
Right. Okay. So this is the published article according to that guidelines. We have submitted that manuscript, right, according to their guideline as a single column article. Finally, they will do the page setup according to their publication criteria. So they have published it as a 2-column article. So in addition to that, they have added pictures to the necessary places, right? So not at the last of the article, right? So they will do that part, but we don't want to do this part. We have to adhere to their guide. So we have to submit according to their guideline. So I think you can see the PowerPoint presentation again. Am I correct?
Yes, we can see the PowerPoint.
Right. Okay. Then because they that editorial board have to submit that your manuscript to a panel of reviewers. So that should be easier to review that. So for that, we have to send it as a single column, right, with double space like that, according to the journal guideline, right? Then, right, after that, you have to see a published case report in a current issue, right? If you have selected journal A, then you have to go to the current issue of that particular journal. Then you have to see a published article, published version of an article, right? Then with that, you can have a broad idea about their publications, right? Then you have to start writing the case report according to the experience or the information that you have gathered, after going through the guide, template, and published report of the particular journal, right? First, you have to go to that journal site. Then you have to read about the journal, right? Then you have to see the aims of that journal. If those are compatible, if they are willing to publish a case report, then you have to go through the guide. Then according to the guide, according to the template, according to the published report, then you can start writing, right? Then your article may be compatible with their requirement, right? So otherwise, when you try to start that writing blindly, that may not be compatible with the journal requirement, right? So then you have to provide the authorship. While you are after writing, you have to provide the authorship according to the intellectual contribution of your colleagues, right? You may have a group. So according to their contribution, intellectual contribution, you have to provide the authorship for them. First author may be, in most of the time, first author means that main person who involved to do the job here, right? Person who handled the case mainly, and person who write the report mainly, right? that person may be the first author, right? So the corresponding author may be the, in general, corresponding author may be the resource person, right? Most knowledgeable person regarding this matter, right? But first author and corresponding author can be the same person, right? It's depending on your team, right? But anyhow, journal may communicate with the corresponding author, right? That is the thing, right? Then you have to acknowledge to the others, right? You may have a supportive team, you may have that supportive fund for that. You have to acknowledge to that funding agencies, right? You have to do those things there. Then we'll see the difference of manuscripts, right? So here you can see the pattern of a research manuscript. Here you can see the pattern of a case report, right? Black color indicates similar, right, parts of those two case reports and research papers, right? Abstract may be similar in both aspects. Keywords definitely should be there in both case reports and research papers. Key points may or may not be there. It's depend on the journal. Then introduction definitely should be there in both case reports and research papers. But in one different is in case reports, sometimes they may definitely they will ask advise you to guide you to add that introduction. But definitely, in certain journals, they may not ask you to add the name, that title as introduction. Directly, you have to start like that. That's the possible difference. Then when you go to the material and method, in research papers, definitely you have to include the material and methods. But in case reports, instead of material and method, you have to add the history, clinical examination, diagnosis, treatment. If it is a surgery paper, then pre-anesthetic medication, anesthesia, surgical procedure, post-operative care, like that. So including that outcomes of your study, then follow-up results, right? Those are the things. Those are really belongs to the methodology, but we may include as history, clinical examination, like that. But rarely I have seen that in certain journals, they have advised to follow the first method. It means we have to mention methodology at the beginning. Then under that, we have to include the history, clinical examination, like that, right? That's the difference. So then when you consider about the structure of the paper, you have to start from the abstract, right? There may have three types of abstract in case studies, right? Sometimes you will see in that particular journal, real content in shortened form without pictures, right? Without pictures. You may have to summarize entire case, but without adding the pictures. Other possibilities, real content in shortened form with pictures, right? You have to add 1 or 2 pictures even at the abstract, right? So it's depend on the journal. So other method is superficial explanation about the study. It means in that abstract, most of the time they may use term summary. They may not explain the entire case in shortened form. Instead of that, in that abstract, they will explain about the study. About the study mean without going for much detail, right? Like this, for an example. So in this case study, we will discuss about 100 BCOCs, right? In this country, under this situation, under this climatic condition, like that. They may not explain about the cases, right? So that kind of abstract also, or the summaries also may be there, right? So in addition to that, other difference is sometimes they may advise you to write it as a single column or single paragraph abstract, or in certain journals they may advise you to write a multiple paragraph abstracts, right? So next point is keywords and key points. After the abstract, you have to add keywords. So what are the keywords? Keywords mean main or common words, right, that you have used in your article, right? Most important main common words, right? If you are writing about equine case, so horse may be one of the key term there, right? Let's say you are writing about equine ocular pneumodiasis, then pneumodiasis is another term, right? So you have to add 3 to 5 that keywords after the abstract, right? That may be supportive editor to find the suitable reviewers. By looking at the keywords, they may select they have a list of reviewers with them, then they will direct that your article to the relevant reviewer by looking at the keywords, right? That is one thing. Other thing is it will be supportive readers to find the publication in the internet, because in online form, when you publish it in online form, when they add to the online form, they will connect these keywords, right, with the online. When somebody try to reach that kind of about equine, then when they type a term equine, then your article may appear to them, right? So those are important aspect of it. Then key points. What are key points? Key points mean few sentences to pointed out the main and fundamental steps of procedure. That is not a term. These are sentence. Few sentence, 1, 2, or 3 sentence. Right? Those are fundamental steps of the study. Right? Most of the time they may ask you to write it in bold manner or with large fonts. Right? But it is not a compulsory thing. In certain journals, they may ask you to add key points, right? So then introduction. So when you write the introduction, with or without the title, in certain, as I mentioned earlier, certain journals may not ask you to add the name introduction, but you have to write the introduction, right? So under introduction, you have to introduce your study. So what is the study? What is the way you have done? It means that broadly. So what kind of cases, right? Introduce your study, then importance of your study, then clinical matter and existing knowledge of it, right? You have to explain those things under introduction, right? So most of the time we may write it in passive form with simple present, right? In simple present tense, right? Under methodology section, we may not write it as methodology directly. We may write it in passive voice most of the time, right? In simple past, right? You have to explain the history. Under that, major complaint, other complaints, animal information, you have to add those things, right? Then about the clinical examination. Under that, environmental, temperamental, then visible, palpable, audible, radiological, biochemical, hematological, urinary parameters, you have to add those things under that section, right? So then diagnosis, you have to add you have to talk about the differential diagnosis, tentative diagnosis, and definitive diagnosis. So when you get a right case, you may have a broad idea of that case. There, right? It mean, for an example, then when farmer complain about the red color urine in his that cow, then you may have a broad idea about the possible cases about the that can lead to red color urine. That may be black and fern poisoning, that postpartum hemoglobinuria, babesiosis, thalidosis. Many cases may be there. So then in your clinical examination, you may able to see the right sample of urine, then you will understand, you will able to understand whether it is hemoglobinuria or hematuria, then you will narrow down it. That is, you may come to the tentative diagnosis. Then with your hematological examination, then you will able to identify the positive factors, then you will come to the definitive diagnosis. Then you have to explain like that, right? So the next one is treatment. If it's as I mentioned earlier, if it's a surgery, so you have to talk about the pre-anesthetic, then surgical steps, post-operative care, those things as well. Then you have to include the outcome. You have to explain the right end result of it, right? Then you have to add the follow-up results. After discharge, you may have to follow up until few days, few months, depending on the case, right? You have to add that data, right? Then you have to add the discussion part. You have to complete the discussion part. Most of the time, we will write it in passive form, right? Under the discussion section, you have to collect the existing knowledge from those things. Then you have to compare with your study, right? Then not only that, you can discuss about constraint you had there. Then you can justify certain things that you have done while you are doing this that study, right? Under discussion, you have discussed all the aspect there, right? In conclusion, so what is your final decision, final message, right? You have to mention those things there. Then acknowledgement, if you have to add somebody to that acknowledgement, right? You can write it in even in active form, right? Then references. For that, you have to see the journal guide. So in the journal guide, they may have given the right way that you have to add the references. You have to add the references in alphabetical order. I think already you are aware, right? We have done several two other right sessions previously. So according to the right journal guide, you have to add the references, right? References may be right differ from right book references, monograph references, right? Periodicals, right? References may be vary, right? You have to follow the journal guidelines for that, right? So then you have to, so what are the documents required for the submissions? Now you have prepared your manuscript or the right basic journal article. Then, right, with that, what are the other things that you have to submit, right? You have to submit main document, mainly, that is the manuscript, right? Online, you can submit it. You have to add the main document there. Then after that, you have to add the declaration of the authors. It means, when I explain it simply, that consent of all the authors, right? There's a document, you have to right, get the signature from other authors, giving their consent to publish it, right? So you have to add that right form. Then conflict of interest form. That's another form, right? So you have to fill that conflict of interest. So to confirm, right, as you are not having any conflict with right any aspect regarding the publication of this right manuscript, right? You are not biased to anybody, right? Not you have not written this right because of that financial support from anybody, right? Like that, you have to declare that, right? Then author's contributions, right? In certain journals, they may ask right contribution of each and every author differentially, right? One by one, you have to explain it, right? Other thing is ethical committee approval. So in most of time, in general, for single case studies or the several case studies, if it is prospective type, you may not require to provide the ethical committee approval. But if it's a pre-planned case study, right, using a number of right animals, then you have to present that report at the beginning to that ethical committee, ethical clearance committee, right, in a university or in a right reputed place. Then they will consider your proposal. Then they will issue the ethical right approval, considering that right involvement, right, or the welfare aspect of animal, right, that things that do, considering the things that you are trying to do there, right? Then you have to submit that approval also. Then separate files with figures, right? You have to send separate files with images, right? Then separate files of supportive documents, if any, right? If you want to provide, or if they are asking supportive documents, sometimes maybe your raw data, right? You can edit, right? That is optional. If they are asking, you have to provide it. Then the next one is, when you submit the manuscript, that editorial board will start their process, right? They will consider about your manuscript. They will consider whether your report is compatible with their right journal. Then they will consider about the novelty of it, then scientific value of it, importance of it to their readers, right? They should have a right considerable right scientific value of it. So then they will check for the plagiarism, right? When I explain it simply, right, you may, in especially at the discussion introduction, you may get certain information from another right published article or another journal, right? You will include that right information to your article, right? But sometimes if you are trying to add that information as yours without giving the required credit to them, right, without putting that citation there, So that's a big mistake, right? Then there are softwares to identify that. Then editorial board will right identify that. That's a big mistake. So we can't do like that. We have to give the respect to the original authors. You have to mention the citation with that part. So similarity index, I mean, when I explain it simply, so it is not a big mistakes, right? When you get that ideas or the existing knowledge from the another article, you may add it to your article. You may add the citation there. You may give that other references there. You may add about their detail in your reference list. But the sentence may be more or less similar, right? You may have used that same sentence in your article as well, or with small differences, right? Then with the softwares, they will identify those things that similarly in already published and your article, right? Then after that, they will consider that, they will assess it, they will grade it as a percentage. Then that is not a big mistake. The most of the journal may allow you to publish if it is less than 30% in similarity index. In certain journals that should be 20%, less than 20%. So if it is higher than that, they will inform you, right? We'll ask you to do the necessary changes of your sentences, right? Likewise, then if it is satisfied, then they will direct your article to the reviewers for the double-blind peer review process. So what is the meaning of double-blind peer review process? So double-blind peer review process means that editorial board may send your article or manuscript to the reviewers without giving your information, your personal information to them. They may not aware about you, right? Then after their evaluation, they will send their explanation, their report to the editorial board. Editorial board may direct that report to you, but without giving their information to you, right? Both parties are blind, right? That is very important to maintain the quality of the journal, right? So then reviewers' decision may be vary, right? Reviewers may have different decisions, right? So in that reviewers report, they may consider about the that novelty, that scientific value, whether you have explained that case completely, whether it is repeatable after reading your case report. Any other person can repeat it, when any other person can apply to the field, right? Whether you have given the required amount of information, right? So they will consider those aspects. Then finally, they will give their consent, right? Whether they are approving it to publish, or whether they are approving with minor corrections, major corrections, or whether they are rejecting your manuscript, right? In general, that editorial board may send your manuscript to two referees or the two reviewers. Then if they are giving two different final decisions, if their decisions are controversial, then they will send it to another reviewer. Then finally, they will decide about your publication. So how to reply the editorial comments and or reviewers' comments? Because after the reviewing, after once the editorial board get the reviewers' comment, they will direct it to you, with their comments. Then when you see their comments, sometimes you may get angry, right? Because sometimes they will ask you to do certain changes. They will ask you to remove certain parts. They will ask you to rewrite certain parts, right? So number one, you have to do the amendments that they have asked you to do. But sometimes you may not agree with certain parts of that, right? Don't worry, you have to justify it. Why you have done it like that? You can justify it, right? But you do not respond angrily, right? You have to reply politely. So you have to respond within a given time. They may provide a certain period to reply, right? You have to provide the reply within the given period, right? So then what are the probable reasons to reject your paper, right? One thing is low scientific value or novelty, right? As I explained earlier. Other one is poor writing language skills, right? Or pattern of the journal. If you are not writing according to the pattern of the journal, then they may reject it, right? Other thing is incompatibility with the scope of the journal, right? They may have right scope. That's why you have to read their scope at the beginning. So then other thing is violation of the journal guidelines. That's why you have to follow the guidelines. If you are not writing according to their guidelines, they will reject it, right? If those are minor errors, they will ask you to correct. They will highlight it, right? If you are totally violating, they will reject it. Other thing is poor or inefficient response to the editor or the editorial board, right? They may send you the message, right, asking respond within 10 days. Then within 10 days, you have to reply, right? Then or else they may send one, two reminders, then they will, right, forget about that, right? Other thing is lack of acceptable evidence. If you are going to publish a case report, you have to have acceptable reports. That's why I ask you to keep all the necessary information with you, right? Especially images, right? If you are going to publish a case report, you have to have real evidences with that. Then lack of repeatability. Although you have explained that case report, right, with the images, everything, but you are not explaining everything. There's a hidden part, right? You are not giving it. So then again, they may reject it, right? So repeatability should be there. Other thing is inability to pay the manuscript processing fees. If you have selected that kind of journal, definitely you have to pay it, right? Sometimes for country like ours or developing countries, they may use certain deductions, right? So you can ask for that, you can demand for that, they will give that, right? When you do it accurately, we'll select for the next volume of the journal, right? Then corresponding author will get the email regarding that. They will communicate with the corresponding author, right? You can see your paper on the site in the next volume of the journal. Then sometimes corresponding author may get the hard copy if they are publishing as a hard copy, right? So you will get invitation from even other journals, because if you are publishing it online, right, everybody can see that. Then other journals may invite you to publish your next publication or the article in their journals, right? Likewise, you will get chance to that event, right? So those are the main things that I have to highlight here. I would like to acknowledge SLVA, Sri Lanka Veterinary Association, organizing this valuable webinar series. So and all the journals that I have taken informations to share with you, and all of you sharing your valuable knowledge with me. Thank you very much.
Thank you, Dr. Dammika. Now the session is open for question and answers. I kindly invite you all to raise any questions that you need to clarify, because I know all of you are very competent clinicians, competent surgeons, and veterinarians who are practicing. So if you have any questions that you would like to clarify about writing a case report, case studies, please ask from Dr. Dammika. Or you can use the chat box to forward your questions. Dr. Dammika, can I ask a question?
Yeah, sure.
Do we have to consider about the ethical considerations when we are publishing this type of case studies?
Yes, as I mentioned earlier, that especially for pre-planned case studies, we have to get the ethical clearance, right? So if you are doing for single case or several case prospective type studies, we don't want to have that, because while we are practicing, we have to do that, right? If it is a planned case study, right? Because for an example, let's say we want to study about the kidney disease. For our study purpose, to get more information, we may get biopsy sample from the animal, right? So we may add a special test, right? So we have to handle more and more those animals. So in that case, we may have to get the ethical clearance for that kind of studies. So some certain journals may not accept without that ethical clearance, but certain journals may accept without considering the ethical clearance for case studies.
Okay, and it will be a good point for the writers to remember when they are trying to compile their case studies. In addition to that, what about the statistical methods or statistical techniques? Do we have to apply any of those tools when we are describing the results?
It means that depending on the type of the case, type of the data you have to use that required that statistical technique, especially retrospective type case study with large number of cases, right? Or not necessary to be the retrospective with prospective studies even, right? If your case number is very high, you may have a large number of data set. Then for the analysis, you have to go for the statistical analysis, right? For in that case, better to consult a statistician. Then before start your study, then they will provide that required guide to you. So because that they will explain about the required number of cases to analyze to apply that particular test. Likewise, before start that type of case study, you have to. That's why I mentioned earlier, you have to consider about the resource personnel, right? If you are not aware about that particular thing, if you not have that particular facility with you, right, you have to identify the required personnel. Sometimes if you want to do the PCR, you have to identify the place that available, right? If you are not much aware about the statistical technique, then you have to consult a statistician, right? You can include a statistician into your group. Then you have to discuss about your plan. According to that, you have to prepare the your data collection sheet. Otherwise, finally, you may have difficulty to add the stats, right? For that kind of thing, because certain test, you may not able to add certain test due to your failures, right?
Okay, that indicates that if you have experts in the team, it is much more value will be added to your case studies. In addition to that, it's more like a teamwork, which can improve the quality of your work.
Yeah, definitely, ma'am. Right. When I am explained that my experiences, right, in when you are trying to publish in very high index journals, actually they may consider about the team. So they are asking about their specialty, right?
Okay.
So if we can prove it, then without any trouble, we can publish it, right? Sometimes we may add statistical analysis there, but when we look at our team, no statistician there, right? But reviewer may have different doubts about our statistical analysis. They may ask number of questions from us, very difficult to justify. Because of the doubt, they may ask number of questions, right? Then we have to have additional effort to justify that. So if we have an statistician in our team, right, then definitely we may have that strong paper with that in statistical aspect. Then in that aspect, we can publish it without trouble from the reviewers, right? Reviewers may not highlight much about different doubts, right, in statistical aspects.
Okay, and what about the archived records? Can we use those records for developing a case study?
You mean that existing records with us?
Yeah, with us. So can we use some other records available that we can access? So,
other records mean so if that record is belong to somebody, then at least that owner of the record should be in your group, should be an author in your team. Otherwise, you have to get the written approval from them, or else that record should be belongs to you, right? You have to justify those things. If you have that records with you in your hospital or somewhere, in written form, then you can use that data.
Okay, thank you for clarifying the ethical perspectives in writing the case reports. In addition to that, can you encourage our participants to write by highlighting what are the benefits of writing these case studies.
Yeah, actually, right. If you can, that's why I mentioned at the beginning, even at the beginning, right? Most of our veterinarians, I know that they are working hard. They have many experience with different types of cases, right? They have encountered different types of techniques, right? They have applied their different approaches to recover their patient. Then they may have different success stories. So one thing is, the number one is, if you are willing to publish those data, right, then others can learn something from you, right? If you are willing to disseminate your knowledge, right, then our veterinarians, right, who working in the world may see that they will catch something from you, right? So you have contributed to disseminate that knowledge, so to broaden the knowledge in the veterinary field, right? So as an institute, if you are working in a academic institute, it is very supportive to try develop. It means that ranking of that institute, right, recognition of that institute, and you will get a recognition, right? So that people may identify you as a very methodical person, and person who keen to disseminate their knowledge, share their knowledge with others, right? Likewise, so that is my, I think, as professionals, those are our responsibilities, right? So without keeping that very important knowledge with us, somehow we should try to disseminate that knowledge to others, right? When you try to do that, you may have many difficulties, right? So but when you do that, it's a very valuable task, and very you have worked as a responsible person, responsible professional, in the field, in the country, in the world. So that will be a very much useful thing for the future, right? So for the future generation. So by looking at your publications, sometimes that our new generations may try to develop those things further. That's how we can develop the science. So you can disseminate that knowledge with the others. So that is our responsibility. Then you can be a responsible professional, right, in the country.
Okay, thank you, Dr. Dammika. And any of the participants, do you have any questions that you need to clarify?
Dr. Kishanti, I have a question from our
Yes,
Dr.
Dr.
Dammika.
Susanta, our president.
Yeah.
Please go ahead.
Yeah,
Yes,
actually, I have come across some cases like those are very novel and innovative. And in such cases, sometimes peer reviewing is, I don't know whether possible, because peer reviewers also not aware of such novelty, or what you call background of this case. So how what is your recommendation? Is this valid comment, or otherwise my misunderstanding?
No. I think then you will be the author of that. So as authors, we don't want to worry about the reviewers. So editorial, board, chief editor may be a renowned person, right? Then editorial board may be that set of resource personnel. Then they will go through your manuscript. Then they will select a suitable reviewer for that, right? So definitely they may able to find a suitable reviewer for that, right? So if you can explain a little bit about that, then I can explain more about your that doubt or the case.
Or example is, now see, if someone is what do you call, identifying a new species of animal having different biological behavior, like that example.
Right. Okay, then that reviewers, sometimes reviewers may not be a veterinarian. Then they will send it to a zoologist, right? So
right. Okay.
yeah, then right, always they may not send it to a veterinarian, right? According to the right type of the manuscript, they will select the suitable person. They will definitely, that kind of case may direct to a right zoologist, right? There are expertise in that because they are aware about the right existing species, that classification methods, right? They are right thorough with that. We are not right thorough personal regarding that aspect. Yes, you are correct in that aspect. Definitely, that editorial board will direct it to a suitable site.
Okay, thank you very much.
Okay, welcome.
Thank you, Dr. Susanta, for the question. Any of the participants, if you have any doubts, anything to clarify, this is the right time to do it. You can use the chat box. If you are having a problem with the mics, you can use the chat box to direct any questions. Okay, it seems that Dr. Dammika has done an excellent job by delivering the content of the webinar today to the participants very clearly. And if they have any questions, no doubt that they will directly contact you as well. And during our undergraduates also, Dr. Dammika was really generous to allocate his time, very valuable time, to guide us, mentor us, and share his knowledge, experience with us. So I have no doubt that if there's any problems that you come across during writing or compiling the case studies, he will definitely help you. So if you have any problems during the writing process, please do not hesitate to contact him. I think you're always willing to help them because of the past knowledge. I'm telling that. So
definitely.
So don't worry about the writing process. Writing may not be your specialty, but please share your valuable experience with the scientific community. And as Dr. Dammika was telling, as a responsible citizen, it's the prime duty for us to share our experience because we can learn from one another. With that, I would like to wrap up today's webinar. And I would like to thank our resource person, Dr. Dammika Perera, and all the participants for joining with us today. Thank you.
Thank you very much.
Thank you, Dr. Dammika. Thank you, Dr. Krishanti, for your great support to success the webinar. Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you, Dr. Dammika and Dr. Krishanti. Thank you very much.
Thank you, everybody.
Thank you, everyone.